Hello, my name is Alicia Maupin. And have you ever known someone who had to have surgery? If so, whether it was a minor or major procedure, I would assume that it was probably done in a nice clean operating room with a full surgical staff and probably some form of sedation or anesthesia was involved. Most people would assume that these are just the basic necessities for all surgeries, and nowadays they'd be correct. Unfortunately, for the patients who received their surgeries in the earlier stages of development, they did not receive these same basic necessities. In fact, most surgeries performed way back then were unsuccessful due to lack of pain control and the use of unsterile surgical supplies that led to postoperative infections and eventually death. It also didn't help that surgeons back then didn't have the same knowledge and understanding of the human anatomy that we have today. This also led to many complications after surgery. When I first began my research on the history of surgery, I came across an article written by Jennifer Whitlock called The Historical Timeline of Surgery. In Whitlock's article, she mentions that although surgery as we know it today didn't begin until the 1800s, you can find evidence of surgical-like procedures being performed all throughout history, some even dating as far back as 6500 BCE, where in France they found skulls that showed signs of a rudimentary surgery called trepanation being performed. This involved drilling holes into the human skull. In the 1800s, when surgeries did become more common, they were performed in operating rooms that were not in very good condition. In an article called Not for the Squeamish Surgery in the 19th Century, written by Ronald Piana, he mentions that operating rooms were rarely ever cleaned, and if they were cleaned, they were not cleaned to surgery standards. They had no form of sanitation whatsoever. They didn't even have sinks to wash their hands in the facilities. He talks about how the rooms were often dark and dingy, and that the surgeons would wear their same bloody gowns over and over and over again because they believed that if their patients saw them in their bloody gowns, it made their patients more comfortable because then they would think that they had plenty of experience in the operating room. None of this would fly in today's operating rooms. In today's operating rooms, they take sterile technique very, very seriously. The operating rooms are cleaned thoroughly before and after every surgical procedure. And before the initial cut that the surgeon makes to begin surgery, they create a sterile field around the patient so that they do not cause contamination. When they create the sterile field, they take sterile drapes and place them over the already sedated and prepped patient. Once the sterile field has been created, anybody who plans to approach the sterile field must first go through a sterile hand wash where they wash their hands and their skin is rendered surgically clean. And after that, they must then don a sterile gown and sterile gloves before they can approach the field. Once they do approach the field, it is very important that they pay very close attention to everything that is going on around them, because if they come in contact with anything that is, or with someone or something that is not considered sterile, then they would be considered unsterile and they could end up contaminating their sterile field. So it is very important that they pay attention and don't touch anything that is unsterile. They also learn to sterilize their instruments, and now they take that very seriously. Each instrument, insert, or implant that plans to go onto the sterile field is sterilized in an extensive sterilizing process these days. As of September 2019, according to the Patient Safety Network, there were only 2 to 4% of surgical site infections in patients after surgery, whereas in the 1800s, almost 80 to 90% of patients had surgical site infections after surgery due to their lack of sanitization and sterilization. Another really important advancement in surgery was anesthesia. In an article called Historical Development of Modern Anesthesia, written by Daniel Robinson, he tells us of how the anesthetist William Morton worked along surgeon John Warren to perform the very first successful surgery that included anesthesia, and they did so on October 16, 1846. Prior to the introduction of anesthesia, patients received little to no pain relief at all during surgery. So that meant that they went through a lot of excruciating pain and a lot of emotional distress. Some patients were offered a mixture of herbs and alcohols to help ease the pain, but this also had little to no effect on them. Since then, new forms of anesthesia have been developed, including general anesthesia, local anesthesia, regional anesthesia, and even monitored anesthesia, also known as sedation. These have helped to improve the surgical experience for so many people for so long. Anesthesia is mostly beneficial for two main reasons. The first reason being that anesthesia allows for the patient to experience surgery without being in excruciating pain. And the second reason being that anesthesia allows for the patient to stay unconscious, so that way the surgeon can perform the procedure with ease and more efficiently, because then the patient wouldn't be moving all over the operating table. It is clear to see that there have been many advancements over the years in the operating room. There are better operating room conditions, better sterilization techniques, and more anesthesia options for those out there who need them. There have even been major advancements in the operating room staff. Way back when surgery first started, you would often find only the surgeon in the operating rooms, and they may or may not have had an assistant or two with them, but that was generally it. Nowadays, you can be ensured that in every operating room there will be at least one surgeon, one surgical technician or scrub tech, some people call them, one circulating nurse, and one either anesthesiologist or nurse anesthetist. That is the bare minimum that has to be in on every surgery. But in most cases, there are more than that. And if it's a bigger case, there will definitely be more than that, especially if it's a multiple site surgery. Then you're going to have a lot of people in the room for that one. The educational requirements have also changed a lot since way back then. Back then, in order to become a surgeon, all one simply had to do was go to medical school for 16 weeks, and they didn't have any hands-on clinical training. It was all lectures, so all you had to do was go sit through lectures for 16 weeks, and then you graduated. There were no tests involved, there were no grades, there was no exit exam, nothing. You just went and you did your 16 weeks and then you were done. You got to be a surgeon. You didn't have to get your medical license or anything. Nowadays, those requirements are much more extensive. In order to become a surgeon these days, you must first go and obtain a bachelor's degree. From there, you have to take your medical college admissions test and you have to pass it. From there, you have to get a medical degree, and then you need to complete a residency year, or your medical residency, and then after that, you must pass your board so that you can get your medical license. Therefore, they go through a lot more training and both lectures and hands-on clinical training in order to become surgeons today.